fast move away from the ball is a death move because it throws your timing off right away and indicates an overuse of the hands at the beginning of the swing. The problem with this is you lose your tempo at the beginning of the swing, plus the club runs away from your body. You're not in sync. When the hands work with the body and things work together, we're in good shape. When the hands and the club take off, leaving center behind, we're in real trouble. When your weight stays left or even shifts left as you start to take away, this is the beginning of the classic reverse pivot. Remember, we have two pivot points in the golf swing, the left leg and the right leg. Both of your legs hit the ground. People who reverse pivot often think of their head as the pivot point or try to turn around their spine or try not to move in their backswing. This then causes them to turn into the left leg and they stay in front of the golf ball, never get behind it. When this happens, we have sort of a twisting action of the hips. The hips never get that little motion into the right leg, and the person twists. The right hip actually goes away from a line drawn off the right leg. The left hip goes toward the target. From this position, early on in the backswing, you're dead. Tension. Freezing over the ball with no waggle, no little ignition move here from the beginning of the golf swing is a killer. It's a killer because tension always ruins the golf swing. We need relaxed, soft muscles. We need to stay in motion. Remember, the great player stares at the target and glances at the ball, while the high handicap player always tends to stare at the ball, glance at the target, and then have too much tension early in the takeaway. When we see somebody overextend the club back, they are either trying to keep the club straight back in the takeaway or trying to keep their left arm super straight. And this is a pretty common problem. What I see is we have an extended left arm here at address, but we have the ability, because of the elasticity in our arm and shoulder here, to overextend. We have that mobility here in our shoulder to overextend. So if you disconnect right off the beginning of the takeaway, you can actually take the club to the outside. Whereas if you stay connected here with your left arm, you will never take the club to the outside. We see a significant amount of people at Doral roll the club to the inside too quickly in this fashion. Now, a number of things happen right here. One, the left arm leaves the body. Two, the right elbow attaches to your side. Three, the club face gets rolled wide open. And fourth, the club gets way too far inside and also too low. So from this position, ladies and gentlemen, you're history. The game's over. You're toast. Only one serious problem I want to mention with step 3, and that's what we call right knee lockup. And that happens as we go through this area of our swing. The right knee locks up, straightens up completely. Now this is a very serious problem because the whole right side will straighten up. Your right hip will tend to rotate way too much. You'll get way too much hip turn by this stage of the swing, and that will really reduce your coil. What I would like to have happen is for you to stay pretty much in your flex here as you go through step 3. Now, staying in your flex allows you to turn your hips absolutely as much as you want to. You really can't overturn them. When that knee locks up, however, you really can get too much hip turn, which destroys the coil of your backswing. So there you have it. Step 3 of the 8-step swing. A critical point in which you get your club 3/4 of the way to the top. Now that we're comfortable with step 4, it's time to give you some death moves to avoid. First, even if you had yourself in good positions through steps 1, 2, and 3, you're at a risk of tipping your body weight back to your left side if you overturn your shoulders with the arms continuing at step 4. That little extra you strive for at step 4 can lead to a legitimate death move. Remember, it is possible to overturn. Second, in a natural swing, the club face always appears to open in the backswing, then close again through impact. Step 4 should find it in a position that allows you to get to impact square. If the club face is turned too far skyward and is extremely closed at this point in the swing, trouble awaits you. This position is almost impossible to recover from. Last but not least, if you're wide open at the top, you'll tend to throw your hands at the ball through impact and hit a slice shot or shot right of the target. This wide open position is very common in high handicappers, so use video whenever possible to check your at the top position. They are not definitive death moves. What I'm about to show you are. Club shaft tip over. That's when the shaft works out or actually steepens on the downswing, tips out forward. Now the club shaft is supposed to react to your body, and your hands are passive at this stage, so the shaft should work actually a little bit the other way. This is a very common mistake when the hands start the downswing and the club shaft moves out in a very steep angle of attack. When this happens, you either throw the club early or the hands get so close to the golf ball there's really no powerful way to hit it. All you can do is flip your hands, the shaft will come in very steep, or you will actually pull the club down and take a very deep divot across the golf ball. Right elbow back. That's when your right elbow stays back behind your body as you start down. It's usually accompanied with the shaft falling too far to the inside and even having the club head underneath your hands at this stage. Now there's some real problems here. When you come in, your left arm is off your chest, a serious disconnection. You're coming way too far from the inside and your right elbow is trapped here. You're going to have to flip the club now to hit the golf ball or drag the club way inside out. So this is a very serious mistake. Body slide. When your body slides ahead of its address position, your head has gone forward, you are in a death position. Now this is normally caused by the legs not doing anything early on to initiate the downswing. So the legs go dead, the upper body drifts in front, and now you're past the golf ball. All you're left to do is to slap at the golf ball with your hands. Club face problems. From the top of the swing down through step 5, if the club face gets extremely closed or extremely open, we're dead. Let's look at extremely closed first. As we start down, if that club face gets shut, all we can do is hang on and block the ball down the fairway, which will be a major power loss, or if we release the golf club from here, the ball is going to go big time left. The other problem would be to start down with the club face wide open. And again, this is a very common mistake that I see. When that club face is open, we just are not going to be able to square the club face up. So the question is, how far right is this ball going? Now, if we hang on at all, it's going to go off the charts to the right. Otherwise, we're going to try and slap at it and square it up with our hands. Again, a huge power leak. Will move more than it should. Many amateurs have a tendency of swinging the right arm out and away from the body. In effect, the typical high handicapper throws the club at the ball. And it looks something like this. Up to the top, they see the golf ball down here, and they throw the golf club at the ball. Now, the problem with this, the worst problem with this, is that the left wrist breaks down. And when the left wrist breaks down, that adds loft to the golf club. It also makes the bottom of your arc behind the golf ball so that you get a scooping action. And many beginners actually learn to hit the ball this way because their main objective is to get the ball into the air. The problem is when you hit the ball like this, it's the weakest possible way to strike the golf ball. The breakdown of the left wrist is the biggest power leak you can experience as a golfer. So this is something that we must avoid. Because impact occurs in an instant, 4/10,000ths of a second, it may seem odd to devote a great amount of attention to it. Indeed, Some students find it difficult to think about impact. Yet, I've found that working back from perfect impact alignments is an excellent teaching technique. Visualizing perfect impact positions and making lots of practice swings that stop at impact helps you feel the sensation of a good impact position.